This is your Ascension Parish Mental Health Addictive Disorder Advisory Board. We're calling it to order, and that's the first on the agenda, and everyone is present tonight. Number 2 would be the minutes, and I would like to move them underneath number 12 of Dr. Susan Menadolf's report tonight. I'm asking for 2/3 to put on the agenda tonight of the ordinance of G4 to discuss the mental health director. Could I get a 2/3 vote on that?
Madam Chairman, I make the motion that we get a 2/3 vote.
I second.
Do you vote yes?
Yes.
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 Thank you. We're going to put it underneath, it will be number 10, and then the things underneath that will go down 11, 12, 13, and 14. Anybody with a public comment? You need to sign in with the secretary. Nobody with a public comment. Status report. CAHSD Gonzales Donaldsonville Mental Health Clinic. Mr. Ryan.
Good evening.
Good evening.
All right, I have a few things that I want to talk about today. First of all, I wanted to bring your attention to, I attended a meeting a week ago in Donaldsonville concerning the possibility of Donaldsonville acquiring a federally qualified health center. It's one that it would be like the one that's in St. Gabriel. So, do I need to speak up or? Okay. So it would be one that's like the one in St. Gabriel, where they would service people, mostly people who are indigent, people who do not have a primary care home. This isn't something that is set in stone right now, but they're looking at that possibility, and I think that anyone who would like to be involved with that should contact Mayor Sullivan, because it's just in the initial stages. They're looking at the possibility of where the building would be, what kind of services they could provide, such as dental, primary care services, maybe even pediatric services. I believe that this would be something that would be very beneficial to people in Donaldsonville. So I think that anyone who would like to be involved should contact the mayor's office. Does anyone have any questions about that?
I spoke with him today, and he basically brushed me up on it.
Good.
And told me that he had mentioned it to you. So
good.
So we're moving forward some way.
I think it's
a positive.
I really do think it will be a positive thing.
Right,
I think that it will serve a lot of people who don't have health care, and I think that could be something that would. They may even look at providing some sort of mental health services as well. I know that some of the FQHCs do that. So
how would that correspond with you? How would you be involved?
Well, what they would do is the services that the FQHCs provide now are. Some of them have psychiatrists on consult, and they do a lot of medications for people who are stable. So it wouldn't take away from the people that would see us. It would, someone who was already stable on their medication, they could provide those services for them. Maybe somebody who didn't need to be seen, but once a year just needed to have their medications prescribed. It would be beneficial. They also were talking about dental services, which I know in Donaldsonville can be difficult to find a dentist to do some dental work. That's what they were talking about at the meeting. And also primary care services would be the major focus of it.
That'd be perfect, because that's the same thing with Ms. Renda when the lady called me, spoke to me about, and so to me it's like everything is now coinciding together, and that's it. Appreciate it.
Absolutely. Okay. The next thing that I wanted to bring up is that beginning the week of, and I had emailed Miss Italia and the parish president, as well as Roy Katz, and Dr. Mittendorf also knows about this. We are going to need to change our days of service that we are in Donaldsonville. We are going to be, instead of Tuesdays and Thursdays, beginning the week of June 11th, we're going to be in Donaldsonville on Tuesdays and Wednesdays. And we're doing this because Capital Area has given us some more doctor time here in Gonzales. And so to fill the space on Wednesdays, we will need to change the days that we're in Donaldsonville. It won't affect any of the services that we provide there. It'll be the same amount of time for our clinicians, the same amount of time for our doctors, but it will be an added benefit so that our doctors can see more people. That will reduce our waiting lists here in Gonzales, and I think it will be a positive thing. So, does anybody have any questions about that?
You did say that it would help reduce the waiting list here in Gonzales?
Well, that's what we're trying to do. That's one of the things that we were looking at. Right now we have a waiting list, I think, around 50, and hopefully with 2 added doctor days here, that would could reduce the waiting list that we have.
So the doctor still be in Donaldsonville those 2 days, or
it will not affect anything in Donaldsonville. We'll have an adult doctor in Donaldsonville 2 days a week, and we will have a child doctor there 1 day a week, just like we have now. It won't affect any services. It's just a change of the day. Okay. The next thing I wanted to bring up is at the last meeting, Ms. Renda, you had discussed Vivian Getty's program at the fetal alcohol screening, and I got in touch with her, and she said that on the screening form there is nothing that asks what parish that people are served, where they live, and according to her, she said that she could not get any demographic data according to their grant. She doesn't get any demographic data, and nor could she ask for that according to the way the grant's written. She said she would look into it, but as of right now, there's no way to discern what parish people are, what parish people live in.
So they don't have an address. They're not getting an address.
She, according to the grant, can't be provided any of that information. Now, I don't know, on the screening form, the address is not on the screening form. So, and she's not allowed to get that information. That was part of the grant process that they wrote up. She can't get that. But she's going to look into it further, and if something changes or she can get something changed, she'll be happy to do that. But as of right now, we can't provide that information.
Okay. Thank you for checking.
Sure, absolutely. And the last thing, besides the statistics that I passed out, Dr. Kosofsky had the capital area budget for the 7 parishes. I think that's in front of you. I know that you haven't had time to review that. There were just a few things that I would like to talk about concerning that. These are the services provided, not medication. The medications aren't included. So these are just services. By next month, we're going to try to get for you to add in the pharmacy budget, which is a huge amount of our budget. But these are just services provided, and it's broken down by parish, how much money is spent in each parish. Now, the other thing that I wanted to point out was that the services that are provided in East Baton Rouge Parish are also available to Ascension Parish citizens. So, for example, we have an assertive community team which sees children that has a small number on their caseload. And I think that the social worker now has a caseload of 6, and 5 of those people are from Ascension Parish. That will show up on there as East Baton Rouge Parish Services because she's paid in East Baton Rouge she resides in where she works is in East Baton Rouge, but she's servicing Ascension Parish kids. So, but that won't come up on the Ascension Parish side of that. So, this is a underestimate of really the services that are provided, but the way they break things down, if we, for example, we may have a doctor that's seen out here 1 day a week, but is in Baton Rouge 4 days a week. They would be counted on the budget as East Baton Rouge. So. And if you don't have any questions right now, if you would look over that for next month, and if you have any questions, I'd be glad to answer the ones I can and get with Jan, Dr. Kosofsky, if I can't answer them.
And thank you for that. That's what I was asking for. I appreciate it.
Absolutely. And that's all I have. Is there any questions that y'all have? Okay. Thank you.
Thank you, Ron. Status report, Ascension Counseling and Substance Abuse Center, Dr. Susan Mendenhall.
If you look on the report that I gave you in your package, you'll see that I added 2 new tables. The telephone call screen so that you can keep a running comparison to the ones from the previous months beginning in 2007. And at the bottom of the page, the services provided in Donaldsonville, or we'll keep those, we'll count them in our total, but we'll break them out for you so you can watch the development of the caseload there. There's one issue I'd like to get some guidance on, please. We're having a problem with collections. We use a sliding scale at the agency, and the sliding scale goes down to $2 a visit, and in some cases we have no fee at all if someone says they can't pay the $2. Clinic policy allows them to charge up to 3 visits, but what's happening is that some of the clients never pay the bill. And I'd really like some guidance from you all on how you want us to handle that. In the past, we have written off those amounts. I know that Capital Area is going to a payment at the time of service policy for all of their clients beginning in July, I think, or August. And I wanted to see if you all wanted to consider doing that, if you'd like us to consider just to continue doing what we are doing.
Susan, I've been noticing on the top line up there where we show April's collections for 2007 and 2006 and 2005, there's beginning to be a great drop there. That wouldn't be a $2. That wouldn't be. That's the $2 drop you talk.
No, the collections are all sources of revenue except grants for the month.
So why is it? Why?
It goes up and down depending whether Medicaid has paid that month.
Actually, I do remember
managed care payments.
But every month it is going down considerably. I mean, it's 4,000 in 2007, and it was over 9,000 in 2005.
Our total collectibles are probably about $60,000 a year.
Okay.
It could have been very well in 2005 that we got Medicaid that was paid for 2 months in the month of April.
Yes.
It could have been, February, Marches that was paid in April, and sometimes that happens.
They're not consistent in their payments.
It doesn't necessarily mean that there was less services or less monies collected during that month. It could have been very well that it
So I needed to add maybe a 6-month average. 6 months for each side, and come up with something. And I do remember that Medicaid and Medicare pay at different times some months. Okay. And as far as the collections and all, Susan, I would suggest that this board have a chance to do a workshop and figure out how we could help with that.
Okay. What would you like from me to make that happen?
Huh?
What would you like from me to, what sort of information would you like?
I'll get back with you on that.
Okay, that'll be great. I just want to sort of alert you that that's an issue that we really need some guidance on.
I had red flagged that, but it was because of the top, and I do remember that Medicaid and Medicare play a great part in that.
Under needs assessment, we need approval of the Rose Consulting contract that the lawyer approved on the 7th, May 7th. I think you have that in your packets.
Yes, ma'am. Somebody like to make a motion that we accept the contract. The lawyer has approved it.
I'll go ahead and make that motion that we accept the contract with Robert Rose Consulting that the lawyer has approved for our needs assessment.
I'll second.
Motion made and second. Made by Renda, seconded by Brian. Vote. Mr. Butler?
Yes.
Yes.
Atis. And I vote yes, too. Motion passes unanimously.
Madam Chairman, I'd like to state I was at that meeting that night, that it was approved, and they was concerned and wanted to make sure that the Mental Health Board knew about it. So that was my purpose for being there.
Thank you. Okay. And
Under personnel,
just a minute, Susan. Didn't we transfer the part of the funds to?
Right.
Okay, and so we really don't need a second. The board just needs to know that they transferred.
Actually, that's on the council agenda tonight.
That's on what, ma'am?
It's on the council agenda tonight.
It is on the council agenda tonight?
It
Thank
went
you.
to finance last week, and it's gone to council tonight.
Thank you. Okay. Yes, ma'am.
Under personnel, I'd like to know about the status of the position upgrades for the clinical manager and the program coordinator for substance abuse. Is that something you all want to
That's
give a
another
decision
thing.
on this
We're
week?
going to start doing workshops where this board can catch up and understand what each one of these are as fast as we can. And I'm presuming that can stay the same at least for a month?
Sure.
Thank you.
Madam Chairman. That's pertaining to a position that we already have on the ordinance? We already have a person to fill that position.
There's no assistant director in any of the job descriptions?
On the ordinance, it states...
Well, we're not going to fill it tonight. We're going to
It's
do a
already
workshop. We're going to do a workshop and discuss. Yeah, I understand what you're saying.
Okay.
And we will
I just wanted to make sure that according to the ordinance, it's already done.
Yes, ma'am.
Under grants, I just wanted to let you all know that I'm working on a grant with Ascension Parish Schools. It's an emergency management response grant that's going in Monday. We will not receive any money from this if they get it, but we will receive training for our staff in mental health and crisis response, and it'll be very helpful for our people to receive that training. So.
So they're going to pay for the training. We're not paying for the training.
We're not paying. It doesn't cost us anything. We don't get anything in terms of money. It's one that they will apply for. I'm just writing it for them. Under board approval of revised policies, Jeff Diaz approved the 307, 501, 101, 104. So if you all want to defer that until you can discuss it more, I just want to let you know that had been done.
Yes, each one of us need a chance to read it now.
Okay. And
Okay, where did she go?
I guess it's premature to talk about the name change. Just when you've decided all of that, let us know how much money we can use to change the signs and the building signs, and let us know how you want that done.
On that, okay, tonight this board will have to vote. The Personnel Committee okayed it, and I haven't given y'all my report yet, but we need to vote on the name. The only thing is, on the building it says center, and they okayed either center or clinic or whatever. I don't mind which name we accept. As you see, it says under 9, the name of the clinic, to change our paperwork and everything to go along with it.
And I put pictures of all of the existing signs and the pictures of the outside of both buildings.
With the
so that you can
signs,
see.
I suggest that we hold off on the signs until we check our budget.
It's fine with me.
All right, and under the next one is the stationery. We use the stationery we have until it runs out, and then we order it with the new name. And the business cards, we use them till they run out, and then we order them with new names. Now, the only thing we need to do tonight is make a motion that the name of the clinic and all paperwork and what have you will go out with this name. And it shall be the Ascension Parish Mental Health and Addictive Disorder, and either y'all can put clinic or center. Center's on the building. I think they approved it the other night with the word clinic. So that's up to y'all.
That's for sure. You know that for sure that it had it as clinic.
No, it's our decision.
Okay.
It's our decision. And like I said, center kind of means that you can come and discuss something and not see a doctor. Clinic means medical. That's just my interpretation of the word. Whichever, just let somebody decide which word we want and somebody make a motion.
I'll make the motion that they issue name change to Ascension Parish Mental Health and Addictive Disorder Clinic by Personnel Committee.
All right.
Personnel Committee.
All right. Need a
I'll second it.
and then we need a vote.
Yes.
Ms. Z?
Yes.
Yes.
Yes. I'm trying to write who made the motion in a second, and I couldn't think of your name. I'm sorry. Jerry, and who seconded it?
I did.
Brenda. Oh. Okay.
And the last thing on my report is that I'd like to thank Ms. Baptiste for bringing our materials to the St. Paul Fair and setting up the booth, and that's really a big thing to do, so I really appreciate it. Thank you very much. Any questions?
Yes, ma'am. We need to go back to number 10.
Just before you go to number 10,
okay.
I'd like to thank you, Dr. Midnoff, for giving me those materials, and it had everything in it that we needed.
And we always
Besides.
have
Thank you
a
very
supply of anti-substance abuse handouts. So if you
Right.
ever need them for a meeting or group that you belong to that you'd like to,
Right.
And they all say don't use drugs, so be drug-free or
Right.
things of
They're
that
great.
sort. So,
Very fine material.
yeah.
Thank you.
Okay. Number 10 is this ethics. And in our package, they had some emails. I did not understand that it was the board who needs to now ask for this ruling. Is that correct?
It is. What Jeff Diaz explained to me was that he's gotten as much information as he can without making a formal request to the board. He's talked to the board's attorney, the Ethics Commission's attorney, who said it sounded fine to her. His concern about making a formal request to the Ethics Commission is that it often opens a big can of worms that, then lots of things come under scrutiny. But he said it's not his call, it's your call, and so
But
that's...
on that email you sent us, it says that if we know about it and we don't do anything about it and it comes up later, we could stand a chance of being in serious trouble. If I read that number 10 correctly of that email you inserted into this package.
Well, I was trying to give you the whole email history there so you could make a good decision, and you might want to talk to him some more. It's a very complicated issue.
Well, that next week, I would like to suggest, board, that we do an emergency meeting next week, have Jeff there, read all these emails, take his advice, and then I don't know if we need to make a motion tonight to hire him if he says we need to do that, and put a stipulation on that depending on the lawyer's reply.
Can we
That'd be
just
perfect.
meet with him next week and see?
And whichever day he has available.
I think it'd be to our benefit to get him more involved as far as appearance-wise, rather than verbally over the phone or
I want him in that meeting.
We'll get a better explanation, and he can sit there and explain to us, the do's and the don'ts on this before we actually make a decision.
Yeah.
As far as legal is concerned. So.
But now we can't vote in that meeting, so we will have to make a motion here tonight. If he recommends that we go forward with this, we pass it tonight, that we go forward with it.
Mm-hmm.
I have a question for Dr. Midnoff.
Yeah.
Has the legal made any contact with the Ethics Board thus far at all?
He said he talked to the board's attorney. I'm not sure what that means, if in terms of the Ethics Commission itself. I don't have any more information than you have in the emails.
Okay, but he said he...
I haven't talked to him about it. We just sent the emails back and forth, so you all will have a record of the correspondence.
That scares me.
What I'm clear about is that it's not my decision, it's the board's decision, and so I want to provide you with as much information as you need to make it. And I think it's a very good idea to meet with Jeff and then maybe come back to the next month's meeting, June, and then address it there.
I think it'd be in our benefit to meet with him before we make any decisions on that.
Okay.
Yeah.
But the only thing I'm trying to say is we will hold off 1 month getting him to write if he needs to write. If we see him, I guess he could write.
And even if
He's already written them a letter.
He's already written them a letter?
He's written a letter,
Okay.
but I think it went to the board's attorney.
Okay.
I'm not completely
And it
clear
was
on
not
that.
like a report or whatever, it was a question
It was
of-
explaining the situation and explaining that we didn't get many resumes when we applied for the position, and we were able to find one person and what the problem was, and it explained the whole situation.
So the Ethics Board is aware of
The
something that
Ethics
he's
Board's
contacted them already?
attorney is aware. I don't
Okay.
know what that means in terms of the
Okay,
Ethics
thank you.
Commission.
Miss Celeste, would you please contact Jeff and see as early date as possible? And We have 2 people here that have jobs. I would presume you would need to meet at 5 or later.
That would be best if we could.
Jerry, you shift work.
Is that
If
a
it
meeting
happens
with all
to be
board
that
members
4 of us
present?
can make it,
That's fine.
you going to be fine with that?
Yeah, that's fine.
Okay.
Is that a meeting with all board members present?
Yes, ma'am. It'll have to be publicized 3 days before we have it, right? Yes, ma'am. All board members are to be present. I will not take that responsibility myself. Okay, so that's it. Even if we get it with Jeff, then we run the notice, and the notice will say what time, Jeff, and it doesn't matter. Any day next week, if he tells you Monday, then you run the ad Monday. You have permission to run the ad Monday. Just notify us, and we will be at that meeting. And whether it's held here or at the mental health building really doesn't matter to me. Or in Jeff's office. Just whatever's convenient. Appreciate it.
I have a question regarding to number 13.
Let me get down. We moved the minutes to number 12, and the reason for that is last month we asked that the minutes include all subject matters, and it seems like that Miss Susan thinks that we don't need to, when we said word by word or word for word, we didn't mean the every a and it and but we did mean every subject matter. Therefore, the minutes tonight has not been approved because it does not have every subject matter that was discussed at our board meetings for the last 2. We will get that, and we will get it done. Let's see. You have a... You want to be recognized?
Yes, ma'am, I'd like to. On that issue, we have a paper from legal stating information on the minutes, and I'm not going to go through the whole thing, but one of the statements is located in number 3 under written minutes, and it states, the substance of all matters decided, and at the request of any member, a record by individual member of any votes taken or any other information can be recorded. So it's like you've just said, we're not asking for every and every buts and these, but I am requesting our minutes to be what we want put in the minutes. It also states that the secretary cannot make a statement of her own or add to or take away. So if the secretary cannot do it, then no one else should be able to do it. The secretary should be able to do minutes as they are supposed to be done. Okay, I've gone through some minutes back from December of 05, December of 06, I'm sorry, December, January of 07, and February of 07, where I had 2 sets of minutes. Okay, and I know that's during the time that our secretary was taken, and we just got you back, and we're glad to have you. But the 2 sets of minutes didn't correspond with what we said our set did. But there's another set that was saying something different and left out everything that happened in the meeting. So that's why I requested what I requested. We cannot have everybody writing minutes.
Okay. So the minutes will be... We will sit down with the secretary and get the minutes for y'all for the next meeting. And we don't need it reported to legal. I didn't do it. Okay, Mr. Butler, you have something on number 13, you said?
Yeah, I had a facility operation and maintenance. I was trying to find out what the status was on the air conditioning in the Donaldsonville clinic. I've been hearing it for the last month that the air conditioner was broken. And we also stated as a board that it come through me and the committee, anything that's broken or need to be repaired. And the only communication I've been getting is when I get it in black and white. I just want to let the director know I do have a phone number to be contacted.
Jerry, I apologize right there. I was contacted by our board secretary and told that the unit was out, and they had called somebody. She quoted me the price on it, and I told her that it was already in the budget, and I thought we had emailed, the three of you that have emailed. If you didn't get it, I apologize, but we did approve them. I'm going ahead and putting a new unit over there.
Actually, they did quote it out. Bids had come in by Friday, and we expect the unit to be installed this week coming.
Okay.
Thank you.
Thank you.
It was.
And I apologize if you didn't get
The email was sent to all board members out
Okay.
there. So
That must be one I didn't receive.
I will pick up the phone and call y'all. It's just 5 of you. Next time I'll approve something like that. I apologize.
Okay.
Okay.
And excuse me.
There's something about a safety glass in a.
Celeste,
Oh, I'm sorry.
While we were on maintenance, Jerry, did you want to give the board an update on the painting?
You can give it.
Okay. We have put in a requisition to have quotes given to clean and repaint the outside of the Donaldsonville Clinic. We should be, by the end of this month, actually receiving those bids. Myself and Joan and Jerry, if he's available, can come out, and so all the vendors can give us quotes, and we can come back to the board with those quotes and decide what we want to do.
Thank you. Thank you.
Okay.
Madam Chairman, there was something in our packet about a walkthrough at the Donaldsonville clinic. I think Mr. Ryan did a walkthrough or something. We have any information on what was found?
I'm sorry, I'm lost.
Oh, okay.
I do
in the
remember
package.
something about a walkthrough, but
It said it was a walkthrough, and I was trying to figure out. We have a committee. Why certain people were selected for a walkthrough,
well,
and it didn't come.
I
to
do
committee.
remember seeing something about a walkthrough, but I truly don't know what the walkthrough was about. Whether it was
Okay, we'll table it.
okay. Appreciate it. We'll look
Thank
it up
you.
and we'll come back.
No problem.
All right. And then the safety glass thing. They say that the safety glass is safer than the plexiglass. Do we have a report on that from the Parish Safety Office? Miss Celeste?
I suppose, yeah, I talked to the safety officer. Someone fell in front of the clinic, and he was inspecting the place that was at fault and discussing the repairs, and he hit on the glass, and it's practically falling out. He said that really needed to be replaced with safety glass, and that it was not secure, and that
Well, they can
that was his
secure it.
recommendation. But I didn't. Yeah, it was a security thing. I didn't get it in writing.
Yeah.
He just said, "While you're at it, you know." So,
Yeah.
Mrs. Cokie handles all of the repairs and to the facility. So I included it on my report just for your information. But she's going to be responsible. She's always been responsible for that. So we don't have to go forward with that. That was his recommendation.
Okay, but so if it's loose, let's have someone come and put it and fix it, because I think that plexiglass is just, unless there is a real true thing that this safety glass where it is more. He suggests that be done because it's dangerous. We will take care of it, but if it's just for cosmetics, no, we're not interested. Okay?
Actually, I have a work order for them to come out and look at it for us.
Thank you very much. Okay, and the fair is the next thing on this list, if I'm right.
She thanked me already for.
And you thank them for that, and I thank you too. And Miss Z and I will represent this board out there Saturday.
Yes.
Okay, let me go back and find my agenda now, ladies and gentlemen. Okay. Thank you, Susan. I got mine all scratched up. Okay, the next is to approve the DA's invoice. Need a motion?
Motion that we approve the DA's invoice.
A second.
Jerry?
Yes.
Yes. And I vote yes. Okay. Reports from the Personnel Committee. Okay. The coroner's fees, they have finance looking into that. So it will be, they will give us a report before it goes back in front of anybody. The name change on the building, we just did that. The policy and procedure manuals, ladies and gentlemen. Anybody have any questions? I'm sorry, on those 3 committees that we attended. I made that very brief, but no questions. Thank you. On the policy and procedure manual, the board asked that we adopt the clean copy that came from Jeff Diaz. And I would like a motion to accept this with this letter from Jeff put into the minutes. Somebody like to give me that motion?
I'll make a motion that we accept the
Clean copy.
clean copy that with the letter that was attached from Jeff Diaz.
Thank you.
I'll second.
Vote.
Yes.
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 Ms. Renda, but yes. All right. Now we need to approve the inserts that's in your pink binder. And Celeste, I had kind of asked for a list of what needed to be in there to get our audit. Is just the ones in here, all the ones that we're going to need?
What Dr. Mittendorf has put in there is what's
That's what
needed
we're gonna
to be
need.
in the policy manual.
Okay. After page 68, I find the first one is Ascension Council and the Substance Abuse Center, minor Bill of Rights. I need a motion to accept that and a second.
I make a motion. The minor Bill of Rights.
I second.
Okay, and the next one I find is after page 72. It's Ascension Council and Substance Abuse Clinic complaint form.
A motion we accept the Ascension Counseling and Substance Abuse Center client complaint form.
I second.
Vote.
Yes.
Yes.
And yes, thank you. Okay, the next one is Employees Code and Ethics. All right, the first one is, let's see. Oh, sorry. Okay, it follows page 81. It says Ascension Counseling and Substance Abuse Center Clinic Complaint Report Log. Motion?
I make a motion to accept the Ascension Counseling and Substance Abuse Center client complaint reporting log.
Second?
I'll second.
Vote?
Yay.
Yes.
Yes, Madam Chairman.
Thank you, sir. The next one follows page 95. Ascension Counseling and Treatment recommended. Someone?
I'll make a motion to accept the substance abuse treatment recommendation.
Second?
Second, Madam Chairman.
Thank you. Vote.
Yay. Yes.
And yes. Approved. Okay, the very next page is Ascension Counseling and Substance Abuse Center, Gonzales and the Donaldsonville Clinic. And this is telephone screening, the weekly.
page.
Oh, I'm truly sorry. The one after 95, the one we just approved, is the very next page.
Okay. Right.
Motion.
I have
A question?
I have one question about this.
Yes, ma'am.
These can be modified. What is the procedure if this gets modified, for this to be modified?
It has to come back in front of this board.
Okay.
Now, any of these could be modified due to a grant or a change that is required that they be changed. But all it has to do is come back in front of this board and it can be approved.
Okay.
Someone make a motion?
I'll motion that we accept it. Parish of Ascension Substance Abuse Center assessment process.
Second, Madam Chairman.
Thank you. Vote, Jerry?
Yes.
Yes.
Yes and yes. Okay, and now we have job descriptions, and we have the clinic service manager. Do y'all want to adopt them one at a time or all of them at one time? You have your nurse, you have, and
What page is that?
once again, I goofed up. This is following the appendix, the pink sheet.
Following 103, Jerry.
Oh, okay, following 103. Okay, then you have the first one. Here's your mental health director. And I don't recall if when this came up before we approved it or not, but I did file an objections to that I thought she should report to this board before she reports to Human Resources. And all this, we can later on come back, and she has written, the mental health director has written you one's different descriptions and all that. But tonight, in order, if the audit wished to come up, I would appreciate it if we would just kind of lump sum these and vote on them. We will do a workshop on all of this where every board member is caught up to date on the policy and procedures and the workings of this clinic and etc. Each one I will call for a workshop for.
Okay.
Okay, so
That sounds good.
so could we make a motion to accept all of the job descriptions in one lump sum? Somebody make the motion?
I'll make the motion that it all be accepted in one lump sum.
Thank you. Second?
Second, Madam Chairman.
Thank you, Brian. Missy?
Yes.
Yes.
Ms. Renda? Thank you. The next is the organizational chart dated 10/10/06. I need a motion to accept it.
Madam Chairman, I'd like to make a motion that we accept the organizational chart that's in this particular manual. Ascension Counseling and Substance Abuse Center organizational chart of 10/10/06.
Thank you.
Thank you.
Second?
I second, Madam Chairman.
Thank you. Jerry? I can't remember how to spell Jerry tonight.
Yes.
Yes.
Thank you. Okay, the next one is Ascension Mental Health, and this is the board members. I presume everybody's got the right address and the right thing on it. Everybody check it right quick like. No changes. Email's the same. Did I not tell you where that was? It follows the flow chart.
Yes.
Sorry.
Correct.
Brian, your email's the same?
Yes.
All right. Miss Adobe and I do not have email. She has cell phones. Somebody vote to approve?
I make a motion that we approve Ascension Parish Mental Health and Addictive Disorders Advisory Board list.
Okay, somebody second it? Who second this list of our...
I have a problem.
Second.
Oh,
Madam
you have...
Chairman.
Oh, I'm
Second.
sorry.
It's fine.
Oh, you have a problem with the dates out there? I did call, I'm sorry, Jerry, you should, before can we get a second and then I'll tell you what
You
it is?
had the second.
Who is that?
I did.
I'm sorry. The date out on the side of Mr. Jerry Butler says he comes off in '07. He actually comes off in, I think it's, Jerry, I don't know. I have it straight with Susan. I have the paperwork over here. That's an orange folder. We will correct that before, we will correct that with correction,
It
okay?
came up once before. It's 10.
It is 10, thank you.
And she did call and check.
And I did call Suzanne and check with her today. Okay, and there is another, there seems to be 3 coming off on 010, and our bylaws and our ordinance does say 1 comes off each year. That mistake was made way back when, and sooner or later we're going to get it straight. And that's why I thought they had put you as 11 or 12 to make us straight where 3 people didn't come off in 010. So let me check that out before we positively accept that.
Okay.
And if there's a correction, we'll make that correction.
And one more thing, which Celeste has it and Director has it, email address for me.
Uh-huh.
It's not in here for the board usage if you have to. I can be reached at jbutler1@bellsouth.net.
Give that to Miss Celeste after the meeting.
Yeah, she has it. She has
All
it. But
right.
it's just not in here.
Okay. Celeste, you'll include that in there for us. And I will get back with you on what I talked to Suzanne about, because I truly...
I thought I remember myself.
yeah, I did get it corrected, but I talked to her today, so... Okay, and the next is the ordinance. The ordinance we cannot change. We just need a motion to accept it.
Madam Chairman, I motion that we accept the ordinance as written.
And second it.
I'll second.
And a vote. Jerry?
Yes.
Ryan?
Yes.
And Natalia, yes. The bylaws. Make a motion, and our bylaws has already been accepted but once this year, but if just to satisfy me, will we do this again? A motion to accept the bylaws.
Madam Chairman, I motion that we accept the bylaws as written.
Okay, second.
I second, Madam Chairman.
Thank you. Vote, Jerry?
Yes.
Ms. Renda?
Yes.
And myself, yes. Ascension counselors. We have one counselor that's name is missing, and I suggest that we write on the side of those the districts that they represent. Ms. Celeste? Any other suggestions on the counselors? I don't know if their addresses and their other things should be listed here, but at least their district as to who they represent. Can we get a second on that with the corrections?
A second.
I need the motion first. Sorry.
I only give you what you ask for.
That's exactly right.
I'll make a motion that the districts be added to the Ascension Parish Councils.
Okay. And the correction with the other one added. Okay.
Yeah.
And
I'll
second.
second it. Second the motion.
Vote, Mr. Bryan.
Yes, Madam Chairman.
Yes.
Thank you. All right, ladies and gentlemen, we now have a policy and procedure manual with the inserts, everyone that I know is in there approved. Thank you.
You're welcome.
Yeah. Okay, budget, Miss Celeste.
Okay, I've included in your packets the April budget reports. We usually have a meeting the second Wednesday of each month to discuss the prior month's budget, but due to a conflict in my schedule, we wasn't able to meet this month in regards to, I think that would be March's reports. So next month, we're going to continue on that second Wednesday with the meetings to discuss the budget. But in the meantime, if y'all have any questions with your April report at this time, just feel free to give me a call, and I'll be able to answer those questions for you.
And go ahead.
I also wanted, at our special meeting last month, we did discuss the malpractice insurance. Tonight, that is coming to the council for approval. I did want to get a motion from the board to renew that, our insurance. We did talk about that it was a $50,000 deductible, and that's with a $3 million aggregate. That policy would be in total $50,856, which would be split between the mental health department and the health department. So I'd like a motion in order to renew that malpractice insurance, please.
Madam Chairman, I'd like to motion that we accept those figures. I did attend that meeting.
And thank you. And that's all I had to report for tonight.
Thank you.
Thank you.
And number 10 is the 2/3. And in the 2/3, we put in G4, which is to discuss the mental health board director. And in G4, it states the mental health board may recommend, subject to approval of the parish president, the removal of the mental health director.
Madam Chairman, I would like to make a motion to recommend the removal of the mental health and substance abuse director as of today, but with pay to be extended to May the 31st of 2007.
I second.
Yes.
Yes. Brian? And Natalia, yes. It passed unanimously. So, Ms. Celeste, first thing tomorrow morning, would you notify the parish president of this motion?
Yes, ma'am.
Thank you. Number 11 is the election of officers. We have a chairman and a vice chairman. The floor is open for nominations.
Madam Chairman, I would like to nominate Madam Chairman as chairman.
We have four other people up here.
Somehow you knew it was coming.
Yeah.
Not to speak, you just take the vote.
Oh, all right. Would anybody like to second that?
I'll second.
Okay. And we vote.
Yes.
Yes.
Thank you all. Our vice chair.
I'd like to nominate Miss Baptiste.
I'll
Sec-
second.
And a vote.
Yes.
Yes.
And yes. Thank y'all.
Thank you. Thank you all.
Okay. And under old business, let's see, I don't recall. Anybody else have anything under old business? It looks like I forgot to write. Yeah. Okay. Anything under the new business? Do we have a motion to adjourn?
A motion we adjourn, Madam Chairman.
A second?
I'll second.
This meeting is now adjourned. Thank you very much.
Thank you for a good job.